I could tell she felt so sorry for me because it was the way she was looking at me. She was like, "You're going to be okay, I promise." And then I cried more. I'm just sitting there, tears rolling out the side of my face. They're going in my ear. And I'm nervous. And she was like, "It's okay. We're going to take care of you. It's not going to be bad. You're going to be fine." And that
makes me so sad for
dude,
you.
I can cry right now thinking about it because I was just laying straight up, tears rolling down my face because I was so scared.
What's up, y'all?
This is Beyond 21.
I'm Caitlin.
And I'm Callie.
And we have not been in the podcast studio for 2 weeks.
It's been a minute.
We had to get Jitson and Brock married last week, so we did not do any recording last weekend like we normally do. So, we are back.
Oh, would you like to explain to everybody the ordeal? Because Jennifer asked me yesterday why there was not a podcast posted.
Yes.
Or day before yesterday, something.
So, since I've started my new job, I have been
a busy bee.
Very busy. And then on top of that, I am coming home. We're trying to cook supper, having to go pick the baby up. And then, trying to get a bath or get her a bath, get her ready, eat supper. And then on top of that, these past few days, we've had insurance man calling, to get us signed up for some more additional life insurance through Daddy and his, organization, union, if that's what you call it.
I don't know.
Police union, whatever. So we've been doing that, and we have just been so busy with everybody's schedules and everything.
Well, and the weddings have...
And the weddings, yes, we've, doing
the parties and the...
Yeah, doing the parties, and then we had a paint party, and it's like, you don't want to just work all the time and not do anything fun, so... Justin got married last Saturday, on the 8th, and it was a very beautiful wedding. She looked so pretty, and it was fun, but we did have some issues with Halen. She did not feel like cooperating that day. So
I got to watch her a little bit that day, though. I gave her a bath. She was so sweet.
Yeah, and
she was sweet for Aunt Callie. But
she was fine when she got there. It was just after she'd been there a while.
She was tired of being there.
She was tired of being there.
She's like, "I'm ready to get out of here."
And people that she doesn't know, she's getting to that stage where she's like, if she sees people in her vicinity that she doesn't know, she's automatically going to go to panic mode. And so I think with there being so many people, so many loud noises, and her not understanding, that, you got to behave at this point in time. She's not old enough to understand that. And also she's cutting 5 teeth, so all at one time. So she's got 3 molars coming in, and then the rest of the 2 major front teeth on the right side, because we have both left side front teeth on the top. But so we're doing that. So we've been busy with that, and just we were so exhausted when we got home Sunday from the wedding stuff. So I edited the podcast on Saturday when we got home from the wedding, uploaded it to Spotify really quick, and then I was like, I'm not waiting around for this video to upload, because the videos take a lot longer to upload than the audio. The audio takes 3 or 4 minutes. The video, just going from my computer or that app to the computer, takes about 3 hours, and then another 4 or 5 to go from my computer to YouTube. So y'all be bearing with me if the podcast be dropping late on YouTube. They're never going to drop late. I say that. They're never going to drop late on Spotify, but they may drop late on YouTube. So anyway, that's my spiel about my excuse, if you will.
I think it's a good one.
So, I mean, we're basically getting 6 views per YouTube video, so I thought,
doesn't really matter anyway.
It doesn't matter, but the 6 people that watch it are wondering where it's at.
Yes.
I know for sure Jennifer and Jamie Walker are watching it. Jennifer Bailey and Jamie Walker, they're not together. I had to make that known because I said them too quick together. But anyways, that's all I have to say about that.
I appreciate your effort in the podcast editing. I hope you know.
It is rough.
I don't want you to think that it goes unnoticed.
Oh, thank you. And I'm about to start school. So, y'all, that's another thing. About to start doing some online medical assistant classes. So, y'all be bearing with me for real. And be shooting me some prayers up to the good Lord because it's not going to be an easy thing for me, I don't think.
You got it, though.
Thanks. I know. You're always supporting me.
Sorry.
That's fine. I know you can't lean over. And we're going to get to that. So why can't you lean over?
So, everybody knows about kind of my issues with cysts and periods and stuff. So we're going to kind of hit on it a little bit. Did you hear that?
Mm-hmm.
What a lovely sound. Anyway, so we're going to touch on that kind of just briefly about the issues because didn't we do a podcast?
Yeah, we did like episode 4.
Yeah.
Season 1, maybe.
And that's been a little while ago, so I can give you a little more
and some
updates.
People probably weren't listening that early on either.
That's true. So I'll hit on it quickly. If you want to go back and listen, you can. But I recently had a diagnostic laparoscopy. I sound so dumb when I say it like that. I know that's how you say it, but it sounds so dumb.
It does.
Laparoscopy?
Because you're like, or is it
because it's not
laparoscopy?
It's not. See, because that sounds dumb too. It's scopy. That's how they continued to say it when I was there. It's scopy. Laparoscopy. If I am still saying it wrong, I apologize. I don't care. I'm not a doctor. I don't ever want to be one, so I'm not trying to be so specific. Okay. But, so basically, let's go back. I've always had really heavy periods. They've always lasted for a really long time. And I don't mean 7 days. I mean 2 weeks at the least. And they're, like I said, they're heavy for 2 weeks. So it's not like,
2 or 3 days.
Yeah. Like I'm using a lot of product. Okay. I'm wasting a lot of money on a lot of product. And, I have pains. I cramp really bad. I get really bad cysts a lot. There for a while, I was getting cysts just about every time I was getting my period, and I know that. I didn't go get it diagnosed every time, but I know that because of the pain difference. Like you can, if you know what a cyst feels like, you know the difference between a regular cramp and a cyst ordeal. Oh, sorry. I thought you were stopping. I was like, oh.
My ears are very sensitive this time of the morning.
That's fine. And so I would know what that pain feels like. And it was just about every time I would get my period or right before or right after, and I would have a cyst. And then when it ruptures, like it's really bad. And several times I've went to the doctor about really bad pain in that area. And every time I go, they do an ultrasound, and there's a cyst. The very first one I had, I think, was 5 centimeters when I was like 14 or 15, right? That was like the very first struggles. And then the next times that I've been diagnosed with one, that hadn't been too terrible. I mean, 2 centimeters, 3 centimeters, maybe 4, but the biggest one I've ever had was 6 centimeters, and they were really concerned about that one. And they were trying to decide whether it was big enough to, like, what do you call it? They were going to drain it.
I was going to say pop it.
Well,
that's so nice.
They go in and like have like a big needle and then just like kind of pull the fluid out of it, I guess. But, yeah, so they tried to decide between all that, and they didn't end up doing it. They let it rupture, but it was so big, they considered it. And the reason they decided not to was because, like, I was young. This was like a year or two ago. I was so young, like, I hadn't had kids yet, obviously, and they didn't want to hurt anything, any kind of chances, because obviously it's an ovarian cyst. It's sitting on my ovary. So if they did something to it and it kind of did the wrong thing, it could affect my ovary.
Right.
Okay, so anyway, because of all these problems, and I've gone to the doctor for years, like basically since I started my period, I've been to the doctor or to the OBGYN, the gynecologist, whatever you want to call it. And we first tried birth control. Excuse me. My mom told me not to, and now obviously, like, I'm such an innocent child at this point in my life. Like, I didn't understand why she didn't want everybody to know. Not that I would just go and tell everybody, but why it was such a big secret thing to keep to myself that I didn't need to tell anybody that I was on birth control. Because I know it's in the name, but like I was so innocent, I didn't realize that's what it was for. I didn't know that's what it meant. And I was just like, well, it's just for my period. Like, I don't understand what the problem is. I'm trying to fix, Anyway, so I was on the birth control pills for a long time at a very young age. And so I was probably on the birth control pills from the time I was 13 to the time...
2 years ago?
Huh?
Like to 2 years ago?
No, it wasn't. It was probably till the time I was 19, 18. Because, and we had gone, I had tried the low dose of the estrogen, the high dose of the estrogen, but that was causing me to have really bad headaches. It wasn't doing anything for my period, really. Like, none of these things were working, but I stayed on it because I was hopeful that it would, like, because they told me, well, this should either completely stop your period or it will, really take it down a notch, blah, blah, blah. No, not the case. And I don't understand why I even, like, continued to go off of it. I think I eventually thought it would work and it never did. But my periods never lost the amount of time that they were running. They never got any lighter. Like, it didn't help with anything. It didn't help with the pain. And it actually changed my personality a lot.
All it did was create
a monster.
Angry person.
Yeah. And I was a butthole. And it just made me, mean or whatever. So anyway, I stayed on that for a while, and then I thought, okay, well, I've got to go somewhere different. I've changed doctors several times. Like, then I finally started going to Harbin Women's Center, and I was seeing Mallory. And I love Mallory to death. She did a great job, checking me out and whatnot, and referring me to something else, in which she referred me to the IUD. Her name is Kallie. The IUD's name is Kallie. So I got on that, and she said it was literally supposed to take my period away and all the things. And now I will say, over everything, my period has been one thing: consistent. She's consistent, buddy.
She gonna show up on the 28th day of the month every single time.
And she don't ever change. She does the exact same thing every time. Every time. Same symptoms. Like, before I'll get a little tender in some areas, and I'll get acne, and then I'll get kind of nauseated. Then I'll start. Day 1, very light. And then the next several days, very heavy cramps. And then the next couple days, it's kind of light again. Then it goes back to being a medium flow. Like, it does the exact same thing every single time. She is consistent, buddy.
Day 3, when you're feeling a little light, you're like, no.
She's coming back.
She will be back.
Yeah.
It's like the cat came back.
Yeah. The cat came back.
Every time.
So, anyway.
That period has 9 lives.
It does. And like I said, she can be all over the place, but she's consistent. She be doing other things to me, but she's consistent. I'll tell you that. I've never had any kind of problem tracking it. Anyway.
Meanwhile, I don't know when mine's coming.
Oh, I know every time.
I mean, I can put in a thing and it'll say, oh, you're due to start your period today. And then like 3 days later, boom, there she is.
Yeah. And you're like, thanks.
Sometimes earlier. You never know with her.
Yeah.
She's late to the party every time.
Hey. She's trying to be fashionably late.
Yeah.
Trying to keep you guessing.
Yeah.
So
trying to keep that relationship spicy.
Yeah, she's trying to be spontaneous, But yeah, so I went and got the IUD. She told me that it would help. It would probably take my period away totally. It would do this, it would do that. It didn't do any of that. my period was the exact same as it's been since the beginning. And I just left it in there because I had went through so much trauma getting this stupid IUD in.
Oh, gosh.
That,
refer to episode whatever about Kallie's.
I passed out getting this thing put in. I had to get my mom and granddad to come get me because my stupid self drove up there by myself.
She tend to do things like that.
Try to be so independent, but my body's like, nope, you need somebody. So, yeah, anyway, that was not coming out until it was due to come out because I think I got it in 2020. Yeah, because I was supposed to get it taken out in 2025, May of this year.
Woo!
It expired in 5 years. But because the last time I had went to her and got myself seen about the cyst, no, it's about the cyst, I think, she told me that it was too low and that it needed to come out because there's no readjusting it. If it's too low, if it's falling down, it got to go. So it went a year early. And it was going to be perfect timing because, like, I knew Hunter and I were getting married in October of 24, and then, like, in May of 2025, I was like, well, we'll be married for, a while then, and, like, we might want to start having kids. So it was going to end up being perfect timing with my family plan.
Carlina got Spartan kicked right out the door.
She did. They said goodbye.
She got booted.
My cervix was like, you got to go.
The bouncer said, you have to get out of this club.
Yeah, she was like, get out of here. So she got out of there.
Quickly.
And so then we had an alternate decision since I was getting married so soon. And it was going to be perfectly lined up for me to start my period the day of my wedding. I was not doing that. And I asked her.
Because Miss Flo is a psycho.
She is. And I thought, white dress?
Heck no.
Pain?
Heck no.
On my wedding day?
Heck no.
And I was like, I'm not doing that. So I asked Mallory if there was a way that we could put it on hold for a little bit. And she was like, actually, there is. It might not work, but it might. There's a good chance it will. And then she's like, you can get on the NuvaRing, which is honestly like a
flex ring.
Yeah, I mean it
squeezes down and
like
you insert it.
It's like this big. You can squish it and you just pinch it together, right? And put it in yourself like a tampon, huh?
Silicone?
Yeah, I guess it would be. It feels like it anyway. It doesn't hurt. It doesn't.
Do you feel it once you set it behind that bone? Do you feel it in there or no?
If you feel it, you've not got it up far enough.
See, I think it sits in there just like the Flex Cup.
Probably.
Not the
I've never tried any of those.
Not the cup, but it's like a flex in the disc.
I know what you're talking about.
You fold it up like 4 ways.
Yeah.
Origami fold it and send it.
But anyway, and I will say, this helped me. It stopped my period for long enough for me to have my wedding day, go on my honeymoon, get back, take it out. I started bleeding a couple days later. I've been on that ever since.
Mwah.
It was perfect. Get this too. She told me, but anyway, so it was doing a good job, and it actually, she told me to leave it in for 3 weeks, take it out, let myself bleed, put it back in. And I understood it to be put it back in after you get done bleeding. So apparently I was doing it wrong, and I'll get to that in a minute. But it was actually making my period shorter and shorter by 2 days every time. And so
because
it was more regulated, I guess. It was regulating itself because it was, you put it in, you leave it for 3 weeks, you take it out, you bleed, you put another one back in. You're supposed to do it after 7 days of bleeding. You don't wait until you're done bleeding, apparently. But I didn't know that.
I have a question. Okay, so if your body is gonna bleed for 2 weeks and you stop it a week early, are you not backing up things that need to come out? Because in my mind, I'm thinking, okay, well, if this thing is supposed to be like blocking it off from the outside world, then your uterus is still going to push what it doesn't want in there out. And then where does it go? It backs up. In my mind, that's what I'm thinking.
That's what I thought too, and we'll kind of get to that in a second. I don't have an explanation for that, but
somebody let us know.
Yeah, and
out there.
I have a follow-up question later on for that. So I was trying that. It was working. Like I said, my periods were getting shorter and shorter. Well, then one day at work, almost the exact same time as last year. I don't know why during tax season I always have to go to the ER, but I do. I did that
nerves.
last year with that 6 centimeter cyst. I think it is stress and
it probably is. It's probably one of those things that's like stress induced.
Yeah, that's what we were talking about at work.
You need some of my medicine. I'll give you some of my Buspirone for tax season.
I wouldn't say that on here. Don't tell everybody.
It's just anxiety meds, people. It's not narcotics.
So
not gonna hurt you.
I went to the ER again, and they told me, oh, well, let me back up a second. I was on my period, and I had such bad cramps, all the things. Now, this is like, what was this, 2 months ago? Yeah. Mm-hmm. Or no, it was last month.
Feels like it's been 2 months.
I know. It was last month. So I was having such bad cramps, worse than I normally do. And then I don't usually try to complain about my cramps because I know how bad they are. But this was bad. Well, then when I went to the potty, I was pee-peeing. I had a tampon in.
She was pee-peeing.
And something passed my tampon and came out in the toilet. Did you hear that in my throat?
No, I didn't hear it.
And it was this thick. It was probably about this big. Mass looking thing.
Mass of.
It wasn't bloody. It looked kind of gray and like membraney. It looked weird.
It looked like
it had a little bit of blood spots on it.
It looked like a jellyfish, really.
It actually did.
If you see like a jellyfish with some, like if you were to take your jellyfish and like put a little splash of color in the middle of the jellyfish, it looked like that.
It did look like a jellyfish. I took a picture of it. I still have the picture just in case.
Jellyfish with a human brain in it.
It looked odd, and I thought with the way I was hurting, the way I was bleeding, and what I just passed, I thought I had a miscarriage. Turns out I didn't, because I didn't test positive in the blood test or the pee. So I didn't have a miscarriage, but I thought that I might have.
She took a picture of it, and it did look.
It looked.
When I saw it, I was like,
oh no. Yeah. I know.
I was like, she's about to have some devastating.
So then I started shaking. When I passed this thing, I took a picture of it, and I was shaking so bad, and I was like, oh my goodness. Anyway, so like I said, that didn't actually end up happening. That wasn't miscarriage. It was just my lining. That much. I've passed things before, but it wasn't like that. This was a whole, I could have picked it up and flobbed it around.
It was like the size of maybe this. What'd you say?
Yeah.
Like if you balled this up.
Yeah. If you crushed that down, that's how big it was. But and the fact that it passed my tampon, I was like, how in the world did this get by? Because I at first thought it was my tampon. It wasn't. My tampon was intact after I pulled it out. Anyway, so we move on. I went to the ER. They told me it's no big deal. They didn't care about my picture that I had showed them.
Of course they don't. The ER never does.
No, they didn't care. They were just like, yeah, you're fine. Get out. So I got out.
This is not an emergency.
I went back to work, and I was referred to a different doctor 10 minutes down the road by almost everybody at work, and I went. If you have any kind of female problems, I know Albertville is an hour from Center, but please go see Dr. Melvin Thornberry.
Oh, it's a guy?
Yeah, but I saw a woman. I saw Suzanne, but he's the guy. He's the owner of the place. He's really nice. Everybody there is super nice.
How old is he? Like in his 60s?
Yeah, I would say.
See, I'm
but he doesn't look, you know what I'm saying? He looks really, like,
fit.
He's tall, too. But, like, he was super nice. It wasn't weird, which he didn't look at me or anything. He did my surgery.
Right.
Yeah.
So Suzanne come in there.
Suzanne looked at me.
Suzanne come in there and do my pap smear, and then Melvin will give me the results. Maybe.
Well, we'll get to all that. But, so I go in there. They're super nice. They're super, super helpful. And I go in there for the first time ever, told her my problems, and she said, have you ever been told that you've possibly got endometriosis? I said, well, I've thought it my whole life, but no doctor ever wants to say that I possibly have it because I'm either too young or it's too rare for... How is it too rare? Don't know. That's what I've been told.
How can you tell somebody, oh, you don't have it, without looking, oh, you don't have it, it's too rare for you, you're too young to have... Who said that?
I don't care how young you might think I am. Nothing is too young to be done, okay? I hate that freaking answer. Don't tell me I'm too young for something, because there are children being born today that have problems that you never would have expected them to have because they're too young, okay? Stop saying that.
Like
I mean, you
get a drug problem.
Well, you get kids having open heart surgery when they're born.
Yes, and then you've got kids that are being born with like a drug addiction because you don't expect babies to have drug addictions, but here they are. Their parents are doing crack, and now they're addicted to it, and they're having to. You know what I'm saying? Like, don't say crap like that.
I know. So anyway, this woman, Suzanne. Thank God for Suzanne. And like I said, all these people are so nice in here. They treated me like royalty, bro. They were so sweet. So Suzanne was like, well, you know, you can think about it. There's a surgical procedure that we have, you know, you can get done and we can go in and look and blah, blah, blah. But when I got in there, Suzanne did the works on me, baby. She got me
She went in there for that oil change and she got the works.
She got me a robe, told me to get undressed. She did a breast exam. She did a pap smear. They did a sonogram. They drew my blood and they took my pee. In one doctor's visit, I was in and out of there in an hour and a half with all these things that they did. They got me answers before I left.
Oh, yeah, that's even better.
And when you go to a hospital or somewhere and you get a sonogram or an ultrasound or whatever, they don't tell you what's going on right then and there. But and this ultrasound or sonogram was in their doctor's office. I just went right down the hall.
Yeah.
Got it done. They had the screen like in front of me, and they had their own screen that they were looking at. And I was like, are you allowed to tell me what things are? Because every time I go somewhere, they don't like to tell me. And they were like, no, we can tell you. She told me right there. She was like, oh, yeah, this is a cyst. It's like 2 centimeters. And then she was
did
like,
a little click, and measure.
Yeah. Then they started measuring all the other stuff, and she started telling me all the things in there so that I could
show you your ovary?
Yep. She was like, this is your ovary. Well, one of them was covered up by the cyst, so I couldn't see that one. It was the right side. And I always get pain mostly on the right side. Or the cyst. They're always mostly on the right side. So then I saw the other one. She showed me my uterus and all that good stuff. Apparently, my uterus is a thick girl. After you've had your period. So I don't know if I'm going to get the measurement increments right. I swore she said centimeters. It could be millimeters. But still, the number is going to make the biggest. So I'm going to go with centimeters because I swear that's what she told me. She said that after you have your period, your lining is supposed to be 4 centimeters thick, 3 to 4. I just got off my period. Y'all take a wild guess how thick you think she was? Don't worry, I'll tell you. She was 16 centimeters thick. 16. 4 times what she was supposed to be after I got off my period. I can only imagine how fat she is before I shed. What the heck? Honestly, I kind of felt like that's why I was so bloated. Because, I mean, thick girl, gotta have somewhere to go. Making my stomach bulge out like I'm 2 weeks pregnant. 2 weeks. 2 months, 3 months, 4 months pregnant.
2 weeks pregnant. I was like, dang, we're not supposed to make her laugh.
Yeah, it hurts to laugh. 'Cause my belly jiggles when I laugh. It's embarrassing. And I think it's never done that before, but I think it's doing that because I'm trying to overcompensate for the pain. And so then it just starts coming from my belly. It's jiggling when I laugh. Anyway, I got to stop that. But so
Reminds me of Santa Claus when he laughs.
honestly, that's what it looks like. That's what it looks like. So ugly. It's so embarrassing. I hate it. Anyway, so what was I saying? Oh, so she's thick, and their solution for that, we're going back to the NuvaRing. I told her that I was using the NuvaRing, and she said, well, this is what you need to do to prevent your lining from being so thick. She said, instead of taking your NuvaRing out, bleeding, and then putting it back in, she said, you're not going to take it out unless you're changing it. She was like, you leave it in for 4 weeks, you take it out, you put another one right back in. And she said that was supposed to shed the lining down to where it's supposed to be. Do I understand that? No, because I'm not supposed to bleed now. How am I shedding my lining if I'm not bleeding? I don't know. I don't have an answer for that. If you got one, let us know. I'm confused.
It seems like it's trying to make your uterus adapt to not having an exit situation.
Maybe.
Like it's like, okay, if we keep letting you, it's kind of like you don't get onto a child, you don't stop the behavior, so they keep acting that way. But you put a boundary in place, and over time, they will adapt to minding what you say.
Maybe.
Via the boundary. I don't know. I'm just being crazy.
No, it's not.
Let us know if that's the correct answer.
Yeah, because I'm confused about that. But anyway, we jump forward, and so she tells me, you check all the boxes for endometriosis. You've got cysts. Do you always have cysts? I'm like, yup. Do you always have pain? Yup. You always bleed this long? Yup. And so she was like, do you have anybody in your family that's ever been diagnosed? I was like, yup. I was like, my mom had it after she had my little sister. And so
that's horrible.
She was like, well, I don't know why you've never been told that you possibly have it before, because you're hitting all the boxes. You're answering all the questions with the correct answer to have that. She was like, you can think about it if you want, have the surgery. And see, I was like, I'm not thinking about it. I was like, you're the only person that's ever offered me an answer to my solution.
I will let you cut.
That's not right. An answer to my solution. An answer to my problem. A solution to my problem. I was like, so I'm doing this. She was like, are you sure? I was like, yeah. I was like, let's get this going. She was like, I'll send somebody in here to schedule you right now. Somebody came in there. We set the date. We got it going. I did the pre-op. I did the surgery. And I got a post-op on Wednesday. And they're supposed to go over all of this stuff Wednesday in detail is what Dr. Thornberry told me.
So you're going to go back, or they're going to call you?
No, I have to go back on Wednesday to their office.
Get checked. That's right.
Well, no, not to get checked, to go over the results of everything with Dr. Thornberry in detail and how we're going to start treating it or whatever. He told Hunter a little bit of it. So I go and have the surgery.
We need Hunter to come in here and discuss.
He didn't tell him a lot.
Oh.
And Hunter's, men are not all about details. So
Hunter's just like, oh, can I go home now?
Hunter basically said that all Dr. Thornberry said was that I had endometriosis. That was it. And then we would go over it Wednesday.
From all the black.
Yeah, so I'm going to go over surgery details. Never had surgery in my life. I had to do a preparation the night before. Had to clean myself out.
Should have done like a colonoscopy type deal.
If you've ever drank the magnesium citrate, however you want to say it.
I think.
It's not that bad. The actual taste of it is not that bad, although it gave me the chills because it was so to me, it was like a saline type vibe, and it just gave me chills, but it was it was like very salty Gatorade. It was not that nasty.
Like yellow Gatorade?
Yeah. Oh. It was not that nasty, but it was just like thinking I should have put it in the fridge because I was drinking it like
you were
room
drinking
temperature.
Ooh, that's sick.
But anyway, I did a pre-prep before that. Took a little laxative the day before so that I didn't tear myself up bad and feel like I was dying, because the lady told me I would feel like I was dying after I drank that.
Was it true?
No, because I took the laxative. If I had not taken the laxative, I would have died. I think I would have died. So I cleaned myself out. I had to bathe with a certain body wash the night before and the day of the surgery. I had to drink a body armor 2 hours before my surgery time.
Yeah, they wanted to make sure you had a little bit of nutrients on the table.
Yeah, and when I got there, it wasn't bad. The worst part, putting the IV in. I'm not afraid to get my blood drawn. I don't mind it. It's just a little stick. They draw the blood and it's gone. It's over. But the IV, the needle's bigger, and they're just sitting there
digging,
G-hawing that thing in my arm, like, put it in its place and get out of here. Like, don't dig in my vein. I've got a huge bruise. I don't know if you can see.
That makes me so sick. Ugh.
I'll move. I don't know if you can see that. I'll take pictures and put it on Patreon, I guess. But
it's on the Patreon. So if you want to see Callie's blown vein,
they put the IV right there the first time. That's when she was G-hawing that thing.
G-hawing?
Just kept twisting that thing around. And then she was like, I don't think this will work.
Me, if I was to ever give somebody an IV.
She was like, I don't think this is going to work. And I was like, you got to be joking with me. And she was like, no, I'm not. Your arm is too little. And I was like, she was like, your vein's too little. I said, well, I haven't had anything to drink. Excuse me. And
excuse me. I didn't ask you to pick that one. Pick a better one.
Well, she was going to do it in my hand, but she was like, those are too little because you've not drank anything. I was like, okay. I said, I got a good one right here in this part of my arm.
Like they put mine on top crease. They put mine on my forearm.
Well, she tried to go right here because everywhere else she couldn't get it to, because they were all too small because I had been dehydrated. I mean, I've been pooping myself all day, all night, day before that. I've been pooping bad. I'm not allowed to drink after midnight except for that one body armor. What's that going to do? So my veins were tiny.
Did they even give you a good flavor?
Yes. She let me pick.
Fruit punch?
No. I'd never drank a whole body armor before. I'd only ever tried like a sip or two of somebody else's. She had blue raspberry or orange mango or something like that. And I was like, give me that blue raspberry.
I'd have been like, let me go pick my own. Was
I
it
drank
like
that thing
big?
No, it was a regular
one.
Size.
Oh.
I drank that thing so fast that morning.
You chugging it?
I was so thirsty. I had the nastiest breath when I woke up. And that
that magnesium citrate breath.
It was so wonderful. That body armor was
it like, this tastes like ice from a glacier blessed by medicine man.
Yeah, it was so good. And I drank it so fast. And I actually might get some more of those, in the summertime. She finally, instead of putting the IV here, she puts it in the AC. That's what they called it. Anyway, the bend of my arm.
The air conditioning?
The opposite side of my elbow.
The air conditioning of your arm?
That's what they said, AC. And I'm just thinking my elbow pit, my elbow crease, whatever. I don't know what you call that. But, so she put it there, and then when I woke up, it was in my wrist. But my arm...
They yeeted that thing out after they got you asleep. They're like, she griping too much.
They better be glad... No, they had to do that, because apparently I had to cross my arms when I was... Because when they put me on the table, she was like, give yourself a hug, and I was like, eh. And she was like, oh my gosh, your IV's right there in the bend of you. I was like, yeah. I was like, that's the only place she could get it. And she was like, we're going to have to move that. And I said, please put me to sleep before you move that, because I don't want to do this again. I had already sat there and cried. Anyway, we'll get to all that in a second. But
oh gosh,
so
why did they put you like in coffin position? they're like here.
I don't know.
Let's set her up like Dracula.
I don't know why. I guess because the table was so small and she was afraid that like I would flop my arms. I don't know. But they put some warm towels on me. Hold on, we'll get to that in a second. But
wait, you were in the robe. You were in the robe at this point in time. In my mind, I'm like, okay, she's in a robe.
I've already changed. I've already pooped at the hospital like 3 times.
Oh my gosh. It did not end at home.
And I told the woman, I said, I'm afraid that I'll potty on myself when I'm in surgery. She said, don't worry about it. And I thought, I couldn't tell if she meant don't worry about it because you won't, or don't worry about it because it'll be fine if you do.
It will be fine if you do.
But
you probably did.
I didn't. The puppy pad under me when I got up was clean.
Yeah, but they're not going to put you in a, they're going to change your puppy pad so you're not embarrassed.
I don't think I did.
They probably wiped your butt like a baby. Whoop, whoop.
I don't think I did. But anyway, so, she got the IV in my arm. We sat there for a while. I'm freezing to death, by the way. They start to, the anesthesiologists come in and he talks it to me, whatever. And then Dr. Thornberry came in and told me where the incisions were going to be and stuff like that. And then the 3 ladies came and got me to wheel me out and take me to the room. I've never had surgery before.
Oh, he didn't walk with you to the part where they had to
He had to stay in the room.
Dang.
So she said something about putting something in my IV to where I don't have to take the ride down the hallway with them. So I thought, oh, surely I'm going to go to sleep now. Like, this is great.
No.
I was fully aware. They put my hat on, whatever.
Did you get them to record it?
No.
Kallie!
Because I was so afraid at that point, I let all that go. I was so scared because I was
Did you see the lights when you were rolling, the bright lights? You remember?
Yeah, but I was fully aware. I was fully awake, and like we were rolling, and I was shaking so bad because number 1, I was cold. Number 2, I was nervous, and
they couldn't put a dang blanket on you.
I had a blanket. I was freezing because I was so scared though, and it's cold in there.
Oh yeah.
And then once we get in the actual operating room, oh man, that thing is cold. Okay,
chilly. Wait, did they have like a gallery where people could come sit? Did you take a good look around?
I don't think there was a gallery. I don't think so.
Was it like tile walls? Like dark tile walls?
No.
It wasn't like sheetrock though, was it?
No. It was like, I don't know. It wasn't tile walls, I don't think. But it wasn't sheetrock either. I don't know. I wasn't really worried about it, all the details of that. But, so they got me, and they were like, look, I need you to, they pumped my bed up, to the height of the table. And they were like, I need you to kind of shuffle over here. And I was like, bro, just pick me up.
They're supposed to take the sheets and like 4 of them, like each corner. Boom.
They didn't do that. They were like, just kind of move. And so I was like, moving over.
Trying to pull your gown down where your butt's not showing.
No, she pulled my gown out from under me she said, I'm going to pull your gown out from under you. I was like, great. My bare bottom on this table. And, I mean, there was sheets on the table, but still.
But they weren't, like, stripping bare bottom right there in front of everyone.
No. She just, like, the gown was over me, but she just pulled it out. Like, she untied it on this side and made it basically flat.
I'd have been going, like.
No, this thing was long. Like, it wasn't short.
Okay.
I was covered fully covered.
Like, moo-moo gown top.
Yeah, this was big. And so, so she started talking about hug myself, and then she found the IV here, and she was like, oh my gosh, we're going to have to move that. And I was like, please put me to sleep. And I'm just staring at the ceiling. Tears are rolling out of my eyes. There was this young girl. She had to be a couple years older than me, maybe. I could tell she felt so sorry for me because it was the way she was looking at me. She was like, you're going to be okay, I promise. And then I cried more. I'm just sitting there, tears rolling out the side of my face. They're going in my ear, and I'm nervous. And she was like, it's okay. We're going to take care of you. It's not going to be bad. You're going to be fine. And
that makes me so sad for
dude,
you.
I can cry right now thinking about it because I was just laying straight up, tears rolling down my face because I was so scared of being put to sleep. And so they get these warm blankets and they put them over me. And that made me feel a lot better. I will say that made me feel so good. All the warm blankets. That calmed me down a lot. And then that bigger nurse, she basically laid on top of me. And it felt like a nice little hug from her. She was telling me, she was like, it's okay, baby.
We're trying to hug you.
She was like, it's okay, baby. We're going to take care of you. You're going to be fine. And they put the thing over my face. And the lady said, they didn't hold it. They just kind of set it on my face so I had some, like, real air coming in from the side. And she was like, this is just oxygen. You're going to be fine. This is just oxygen. That was no oxygen.
She lied!
Oxygen don't smell like that.
What did it smell like?
I don't know, but it was weird.
I can't describe. Was it like the pig noses at the dentist office?
But it didn't smell good. It was like this saline type smell.
It was probably just because it was sterilized.
I don't know, but
it was oxygen, but it was mixed with some other things.
I know. But so she was like, are you feeling sleepy? And I was like, no.
You're like, I'm refused.
I was wide awake. I was fully conscious. I was not feeling the slightest bit tired.
You're like, I rebuke it.
And they still had this kind of hanging off my face. Like, I still am getting this real air. And she was like, are you feeling tired? I was like, no. And I was scared to death. And she was like, okay, baby. And so she pushed it down on my face. And she was like, are you feeling tired yet? And I was like, no. And
like, I want to get out.
I can't hardly talk because this thing is over my face. And she was like, all right, baby, we're going to have to put you to sleep. She was like, you're going to have to take 5 deep breaths for me. And she was like, it's going to smell a little bit weird, but it's fine. I took 5 deep breaths. I remember. I counted them out. Because I was making sure.
Like 1.
Yeah, I went. But when I tried to breathe out, like that thing is suctioned to my face, so like hardly any air is going out. I feel my face, my cheeks flapping from the air trying to escape. After 5 deep breaths, I closed my eyes and I heard them. And I told myself, I was like, you're leaving your body now. Like, it's done for you.
What did they say when you heard them?
They were just talking about the procedure.
All right, she's out. Let's start cutting.
But like I could hear them. Like my eyes are closed. I knew they weren't coming back open, and I heard them talking. And then I heard a ringing in my ear, and that was what I was the most afraid of everything. I did not want to feel like I was passing out, and I did feel like I was passing out a little bit because that's how it feels every single time I've ever passed out. I'm there. And then all of a sudden, it's just like,
and you're
I close my eyes and I can hear, and then I can't, and because my ears start ringing.
And like you feel like you're losing control of yourself.
Yeah, I was scared to death of that part. When I woke up, bro, I was groggy as heck.
Groggy as heck.
I asked Hunter something. He said that I was kind of in and out, but I asked him for the picture. They gave him pictures from the thing, mm-hmm. And
I'm gonna put those in a scrapbook.
He showed me the pictures. And then I asked him like 3 more times after that what the picture looked like because I'd already forgotten. And then when they told me to get up and go use the bathroom, and as long as I could pee, I could leave. So I got up.
What were you peeing out?
Pee. They wanted to make sure my kidneys were working correctly.
Right, but like with what liquid?
I don't know. I barely had a drop.
I know.
But I told him, I said, I peed a little bit, but it wasn't much. She said, that's fine. She was like, it's normal. We understand that you don't have a lot of fluid. But so when I went to the bathroom, I peed. And when I got back up, I was so like obviously groggy. I just woke up fully. And I almost passed out. Like Hunter
from pain
helped me. No, from just not having, like I was weak.
Oh.
And when I guess I stood up from the toilet too fast.
Yep, that'll do it every time.
But like Hunter, I told Hunter, I was like, I need your help. So he come in there and like, and then I just kind of went like this, and like, I could tell, I heard my ears ringing again, and I just felt so weak, and I was like, I'm about to pass out. And then he was like, okay. So he just stood there and like held me. Mm-hmm. And then when I came back, I was like,
did you pass out?
No, if I did, it was like for a second. But I think I was fully there, but I was close. Mm. But he put me back on the bed, and
he picked you up and put you on the bed himself?
No, like I was,
or he just
kind of shuffled. Yeah,
I can hear you shuffling.
Yeah, my little grippy socks that they gave me. So yeah, he put me back on the bed, and then I think we got myself dressed, and then they rolled me out, and then we left. I've been hurting pretty bad. The first day, it wasn't bad. Like, it was just my mobility. I felt like I had a plank on my stomach. Like, I couldn't sit up good because obviously, like, I'm trying to compensate for these stitches and whatnot going on here. The next day, the pain in my arm was worse than the pain anywhere else. And yesterday, I was like, the incision sites are starting to sting.
Yeah.
Like they kind of itch or they sting and they just don't feel good.
On them? You keeping like some Neosporin or something on them?
No, there's Dermabond on there. That's why it looks
there's
slick.
Glue?
Yeah.
Okay. Yeah, I just thought you had some Neosporin put on them.
No, it's hard. Like you could. It's not sticky. It's like smooth. Anyway, yeah. So it's not been as bad, I guess, as I thought. But apparently, I do have endometriosis, and I'll get all the details Wednesday.
I have to give you a little update.
Yeah, we'll have to give you an update. But overall, I hope that this is going to be turning out to where I don't have endometriosis anymore, because it can be treated, obviously. I thought originally they told me through shots, but I think what Dr. Thornberry told Hunter was through medicine. So, Either way, if I can get it treated, I want it treated. And then hopefully I can get it treated before I get ready to have kids. And then, the rest is history. We'll keep you updated on that. But as of right now, I can't tell you if the surgery was worth it because I literally just had it on Wednesday and it's Saturday. So when I know more, I'll let you know. And we'll keep you educated on that if you are going through the same issues. But, yeah.
All right. It's been a journey for you, hasn't it?
Yeah. But I was telling Hunter, it's been 10 years because I was 13 when I started having my periods. It's been 10 years, and I'm just now getting some sort of possible relief.
Yeah, that's terrible.
So, I've said it before, and I'll say it again. Do not get on birth control, any form of it. I don't care if you're doing it or not. I don't care why you're doing it. Don't get on birth control. It's terrible for you, and I honestly think at this point it's made me worse than it has helped. It was not worth it. If I could go back and not do any of that, I would.
Honestly,
do some natural remedies, okay?
Practice safe sex, please.
Yeah.
Hate to say that with all of our younger listeners and stuff, but I mean, honestly, use protection and watch who you're doing it with. I mean, don't be going and doing it with everybody because that's how you do not practice safe sex.
Well, also, and you don't know who the daddy is.
Yeah, well, and just use protection. If you're not, because like I'm not on birth control, I never want to be on birth control, but just if you don't want to have a child, practice safe sex. That's all I can say.
Yep. Or don't do it.
Or don't do it. Or remain abstinent. I mean, that's all you can say. That's just our personal opinions. You do what you want to out there. Sometimes birth control doesn't affect people the way it affects others. So,
true.
Obviously, do it at your own risk. If you want to be on it and it is good for you, then by all means, do it. No judgment here. We're not saying don't ever get on it. We're just saying, from her experience,
it wasn't for me. But also, you can go look. There are studies that show that birth control has caused higher risk of unhealthy things. So,
there you go. So, yeah. But I think that's going to be all for us. Is that going to be all for you today?
My butt hurts. You can't sit like this anymore.
Y'all keep liking, subscribing, commenting. Bear with me on the YouTube uploading. Subscribe to our Patreon,
I've been trying to be better about posting. This week I've not posted, but I should have. I meant to. I told myself to take a picture in the hospital.
We've got some good guests coming up soon. And then, so I think that's all for me. So this has been Beyond 21. I'm Caitlin.
And I'm Callie.
And we'll talk to you guys next week. Bye, y'all.
Deuces.